Hello everyone, and welcome to our video presentation about stroke. This video will provide you with information regarding what exactly a stroke is, the characteristics of different types of stroke, who is involved in the support team after a stroke, as well as some background information about research findings, ways to prevent stroke, and how the media portrays stroke and stroke victim. My name is Dan Bacon, and I will be providing you with the initial introduction of what exactly a stroke is. But first, just a few facts about strokes. Stroke is the third leading cause of death in Canada and is also the fifth leading cause of death in the United States. More than 800,000 people experience a new or recurrent stroke each year, and more than 400,000 Canadians are living with the long-term disabilities from a stroke accident. Each year, more than 350,000 Canadians are hospitalized for heart disease or stroke. Potentially the most shocking statistic is that 80% of premature heart and stroke incidents are preventable by adopting healthy lifestyle choices and behaviors. So what is a stroke? A stroke is a type of brain injury that occurs when blood supply to a certain area of the brain is cut off. When the blood supply is cut off from the brain, the oxygen-deprived cells within the brain begin to die off. Once these cells die, the area of the brain is unable to function in the same way as it did before the stroke, and strokes can occur at any given time. So the different types of stroke. First, there's the transient ischemic attack, also known as a TIA. It's known as a mini stroke because a blood clot in the brain only temporarily blocks off an artery with no lasting damage to the brain. A hemorrhagic stroke occurs when an artery in the brain bursts open, and the excessive bleeding is what causes the brain damage. The most common type of stroke is known as the ischemic stroke. Plaque builds up over time in an artery, and the eventual blockage is what leads to the stroke. The after effects of stroke vary in each and every individual. It all depends on the severity of the blockage of the blood flow. The signs and symptoms of a stroke can be found on this slide. Within this course that we've been taking, the Perspectives in Aging have taught us the FAST motto when it comes to stroke. Is the face drooping? Can you raise both arms? Is your speech slurred? If the answer is yes to all three of these, it's time to call 911. The symptoms on the left have been taken from a Heart and Stroke Foundation magnet I found on my fridge at home. When an individual has a stroke, certain aspects of the body function differently than before, or in some cases, not at all. Stroke has the ability to change a person's physical abilities, such as shown on the slide. Muscle imbalances are the most common side effect. Other symptoms include dysphagia and communication struggles, as well as bowel and bladder incontinence. A strong support staff is needed for the victim following a stroke incident. There are many new physical and mental obstacles that will arise after the incident. Ongoing visits to the doctor's office, physiotherapy and occupational therapy treatment plans to help with strengthening muscles and adapting to the change in activities of daily living. But perhaps the most important piece of the puzzle is the immediate family members. These individuals will be interacting with the stroke victim every day and need to be able to offer positive support throughout this new challenge in life. For any information on about stroke and how to prevent, cope, and move on after a stroke, I advise you to please check out the Heart and Stroke Foundation website. This website offers an incredible amount of resources for everyone involved after a stroke has occurred.
So stroke is known as the leading cause of death in Canada, and for about every 7 minutes there are 10 deaths occurs in Canada. The risk factors include unmodifiable, which is age, gender, race or ethnicity, and family history. And another risk factors a person can control, which is high blood pressure, cigarette smoking, and some other factors like genetic and lifestyle, like diabetes, heart disease. According to Public Health of Canada and Heart and Stroke Foundation, have explained the common risk factors, like the risk of stroke increases with age. For after the age of 55, the risk stroke doubles, and two-thirds of all strokes occur in people over 65 years old. So people over 65 also have a sevenfold greater risk of dying from stroke than the general population. Gender also plays a role in risk for stroke. Men have a higher risk for stroke, but more women die from stroke because women, they live healthy life and they live longer, but then when they have stroke, they have at the later age over 70, over 80, and they tendency to die, while 1.25 times that for women, but men do not live as long as women, but they tend to survive at age because they get like over 55. Some stroke seems to run in some families as well. Like some members of the family might have genetic tendency for stroke risk factors such as an inherited predisposition for hypertension or diabetes, and also the common lifestyle among family members could also contribute to familial stroke. According to Informa Healthcare in USA, there is an International Journal of Neuroscience study for racial ethnic differences in stroke risk factors and subtypes. The results were taken based on the hospital registry. So, for the risk for stroke varies among different ethnic and racial groups, this it was found, and the incidence of stroke among African American is almost double that of white American, and twice as many African Americans who have a stroke die from the event compared to white American. It is 5 times of African Americans' death compared to white American. This was found in USA. And the African American have tendency of having stroke in between age of 45 and 55 than whites. But however, after age of 55, the stroke mortality rate for whites increases and is equal to that of African American. So also African American, they have more stroke in the history because they have a family history which they have predisposed, like they have the genetic, like diabetes and sickle cell anemia that predispose them to stroke. So like it's another study from hypertension in the very elderly trial, like Public Health and Statistics Canada also they have said that as what it have concluded by the it was concluded by the neuroscience study that like age and lifestyles mostly like these are contribute to stroke, like hypertension or high blood pressure. A person can actually control, and which is plays a greater role in the overall stroke risk factor. But the most powerful is hypertension. Like most elderly after age of 65, they have hypertension, and this is why they mostly die from, like they have tendency of having stroke. Another thing also is like women, they live longer, but as age increases, then they get the stroke while their high blood pressure is on. So these things like hypertension can be controlled by medication, diet, exercise, and other more. Like, thank you.
There are many ways to prevent stroke early on in life, most of which are modifiable lifestyle changes that can be started today. Decreasing blood pressure. It is important to maintain a healthy blood pressure throughout life. Normal blood pressure should be around 120 over 80. High blood pressure or hypertension increases an individual's stroke risk by 4 to 6 times. Hypertension can lead to the development of atherosclerosis, which causes the arteries to harden due to an accumulation of plaque. If this plaque breaks off the artery wall, it can get lodged and block small blood vessels in the brain, resulting in a stroke. To reduce blood pressure, the individual should reduce salt intake to about half a teaspoon total per day. They should also avoid foods high in cholesterol and fat, and are encouraged to eat 4 to 5 cups of fresh vegetables and fruit per day. It is also recommended to participate in a minimum of 30 minutes of physical activity per day. minimizing body fat and percentage, and losing weight. Just like hypertension, being overweight or obese can greatly increase your risk for a stroke due to plaque formations in the arteries. As your body mass index increases, so does the risk of stroke. It is important to maintain a healthy weight in order to prevent blood clots that can potentially lead to a stroke. Even losing just 10 pounds can vastly reduce the stroke risk and improve overall health. To lose weight, a person should monitor calorie intake and increase the amount of physical activity. Physical activity is necessary for healthy and happy bodies, but it is even better at limiting strokes. According to a study done at Harvard University, former college athletes experience less than 50% stroke risk compared to their non-athletic classmates. The study also mentions that sedentary men were more likely to engage themselves in smoking and drinking, which places them at a much greater risk for having a stroke later in life. Exercise is extremely important at all stages throughout life. Elderly individuals are encouraged to remain active as much as possible within their physical limitations. It is recommended that a person exercise between 3 and 5 times a week at a moderate level of intensity. Alcohol consumption. Overconsumption of alcohol increases the risk of having a stroke. Regular heavy drinking increases blood pressure and can result in both ischemic and hemorrhagic strokes. According to the Australian Alcohol Guidelines, overconsumption of alcohol is more than 6 standard drinks per day. It is also recommended that previous stroke patients limit their alcohol intake to no more than 2 standard drinks per day. However, it is strongly encouraged to not drink at all during stroke recovery. If you do drink, try to switch to red wine as it contains resveratrol, which is said to protect the heart and brain. Smoking. Smoking increases the likelihood of clot formations and can potentially become lodged and occlude the small blood vessels in the brain by thickening the blood. A study by Rena Shah and John Cole determined a correlation between the amounts of cigarettes a person smoked and the greater risk of a stroke. Smoking-related deaths are almost always preventable had the patient not smoked in the first place. It is important that all patients, regardless of age, reduce and/or eliminate smoking from their daily routines to prevent stroke. Monitoring and treating diabetes. High blood sugar weakens and damages blood vessels over time, making clot formations more likely. It is important to monitor glucose and insulin levels to avoid possible damage. Be sure to schedule regular visits with your doctor to determine an appropriate treatment plan to keep blood sugar under control, maintain a healthy diet, and take medications as prescribed to keep blood sugar in a healthy range. There are several different types of stroke that are caused by different factors. Therefore, the treatment to ischemic stroke is different than the treatment for hemorrhagic stroke. Ischemic strokes treatments. Because ischemic strokes limit blood flow to certain areas of the brain, it is important to preserve the living tissue within the area, and this is the primary goal in ischemic stroke treatments. Treatment for ischemic stroke usually begins with taking medications to dissolve or break down existing clots and to prevent the formation of new ones. Usually these medications are aspirin or tissue plasminogen activators, or TPAs, administered through an IV to vascularize and to promote blood flow to the area to minimize and prevent irreversible injury. This is extremely time sensitive as it needs to be administered within 4.5 hours of the manifestation of stroke symptoms. After this window, irreversible damages can occur. There are also several emergency surgical procedures that can be done following a stroke. For example, catheter-directed thrombolysis can be performed to reduce a blockage and improve blood flow. An X-ray guides the catheter into the clot in an attempt to remove it. It can also deliver medications to the site of the blockage to increase the likelihood of dissolution. Another surgical treatment is a carotid endarterectomy, which has been proven to be slightly successful in ischemic stroke. Carotid endarterectomy opens the carotid artery and cleans it out to prevent stroke. It is not a total cure or preventative for stroke, as a blockage can accumulate again, although it is rare. Carotid endarterectomy is not the best method for treating ischemic strokes. The last option is a non-surgical angioplasty. A fluoroscopy X-ray is used to guide the catheter into the blood vessels of an arm or a leg to place a stent, which is a small tube to open up the narrow blood vessels within the heart. When the catheter is in place, the stent inflates a balloon to break up the plaque and the balloon is deflated and removed, but the stent stays within the artery to keep it open. This method is highly effective in treating ischemic strokes. Hemorrhagic stroke treatments. Because hemorrhagic strokes are caused by brain bleeds, treatment of hemorrhagic strokes depends on the severity and cause of the bleeding. Sustaining life, bleeding control, and maintaining blood pressure and intracranial pressure and avoiding seizures are critical following this kind of stroke. Medications are the first method to treat hemorrhagic strokes. These include anticonvulsants to prevent seizures from occurring or reoccurring, antihypersensitive agents to reduce blood pressure, and osmotic diuretics to decrease intracranial pressure. Sometimes an elderly patient may be taking anticoagulants or antiplatelet medications, including warfarin and clopidogrel, to prevent clot formations. Therefore, sometimes a blood transfusion is ordered to counter the effects of these medications. This is important because during a hemorrhagic stroke, the patient is losing blood and it isn't clotting due to the anticoagulant medications. Seizures occur in 4 to 28% of hemorrhagic stroke patients. Most often, they are non-convulsive. According to the American Heart Association and the American Stroke Association, patients with clinical seizure activity with mental status change should be treated with anti-epileptic medications. Otherwise, hemorrhagic stroke patients should be given a benzodiazepine such as diazepam or lorazepam to immediately control seizures. For long-term seizure control, it is recommended that the patient take phenytonin or phosphophenytonin. Following a hemorrhagic stroke, it is best to have continuous EEG monitoring in respect to the degree of the injury to the brain. If there are damaged blood vessels, they may have caused the stroke and will need to be prepared to further stop damage and to prevent future strokes. Surgeons clamp the base of an aneurysm, which is a weakened vessel wall, to prevent them from rupturing. They can also implement coils that can be detached. Their purpose is to limit and stop blood flow to that vessel to prevent it from rupturing. Another treatment method is arteriovenous malformations repair. An AVM is an abnormal collection of blood vessels with weakened walls that have a tendency to bleed. If left untreated, it could lead to a stroke. Approximately 4 of every 100 people with an AVM will have a hemorrhage every year. The risk of dying from a bleed is only about 10%, however there is a 40% risk of a disability following a bleed. Over the course of a lifetime, the risk increases dramatically, especially in a younger individual. This is why it is crucial to treat AVMs to prevent a stroke in later adulthood. Removal of an AVM eliminates the risk of bleeding as it does not grow back. However, not all AVMs can be surgically removed, and careful diagnostic tests will determine if they can be removed or if it is far too risky. Rehabilitation following a stroke is incredibly important. Not all strokes are the same, and rehab will differ from patient to patient. Post-stroke rehabilitation helps patients relearn the skills that were lost in the area of the brain during the injury. Rehab can also teach survivors new ways to do tasks to compensate for any disabilities following a stroke. Rehab therapy usually begins within 24 to 48 hours following the stroke. The first steps are to relearn movement to prevent muscle loss and weakness. There are several different types of rehab that a patient may have to experience. Physical therapy. Physical therapy is crucial following a stroke. It is important to help the patient relearn movement and coordination. This means teaching him or her how to walk, move their limbs, reach, and sit up again. Physical therapy helps to restore physical functioning and helps to address issues such as paralysis, improper balance, and foot drop. Occupational therapy. Occupational therapy helps to restore their ability to perform daily activities including bathing, eating, getting dressed, using the bathroom, writing, and cooking. It is recommended to work with an occupational therapist for 45 minutes 5 days a week following a stroke. Most often, occupational therapist begins in the hospital but can be completed in the patient's home. This makes it much more easier for the elderly patients as sometimes it is too difficult for them to get to a hospital. Speech therapy. Following a stroke, a patient may have a hard time communicating, talking, or swallowing. Speech therapy involves using techniques to compensate and reduce these complications. Commonly, there are 2 conditions that arise in stroke survivors. They include dysarthria and aphasia. Dysarthria is a condition in which the patient can no longer pronounce speech properly, usually due to the weakness of the facial muscles or inability to control these muscles. Aphasia is a condition in which a patient can think but is unable to process language or to talk or be able to communicate and understand others. Speech therapy can help teach the patient and their family how to cope with these barriers to communication. If the situation is extremely severe and the patient isn't showing any signs of progress, a speech therapist may suggest using other forms of communication, including sign language or gestures, or using pictures. Support groups. Support groups are an important part of recovery, especially for older individuals who may not have friends or family there to support them. Depression is quite common following a stroke, and it takes quite a while to recover, and can be a slow and frustrating process. Therefore, having a group of people who have gone through the same thing is beneficial in recovery.
When a stroke strikes, it spreads like a fire in the brain. The longer it goes undetected, the more damage is done. To spot the signs of a stroke, you have to think and act fast. F. Face. Has their face fallen on one side? Can they smile? A. Arms. Can they raise both arms and keep them there? S. Speech. Is their speech slurred? T. Time. Just like a fire, it's time to call 999 if you see any single one of these signs. The faster you act, the more of the person you save. When stroke strikes, act fast.
In Canada, we call 911 and not 999. This TV advertisement focuses mainly on how to avoid stroke before it gets too serious to recover. The FAST acronym, also learned in this class, Perspectives in Aging, thoroughly explains what each letter means. F standing for face, A for arms, S for speech, and T for time. In my opinion, this is a very strong message to the elderly people who has a higher chance of getting a stroke. Most Canadians have access to a TV and watch TV daily, so advertising is one way to spread awareness. As you can see in the clip, the actress was an elderly woman, which targets the elderly population, hence having a significant influence on ageism. Moreover, there are several studies that demonstrate the public's lack of general knowledge on risk factors and symptoms on stroke. This was particularly true amongst the elderly, which is the target age for stroke. There are 4 studies which are carried out by the communities in Ontario. 39 to 44% of those that were surveyed were able to name at least 2 warning signs. However, among those over 65 years, only 35% were able to name 2 warning signs. To resolve this, the study by Silver and colleagues compared different strategies to improve on the public's stroke-related knowledge. One of the strategies were to advertise stroke warning symptoms on low and high intensity television campaigns to improve the knowledge of stroke. After 3 months, the study showed a slight mean increase of naming warning signs from 1.27 to 1.47 in low intensity advertisement and 1.32 to 1.66 in high intensity advertisement. This shows a positive result, so spreading awareness through advertisement is one good way to fight stroke. Thank you for listening to our presentation.